guys, this is Dr. Madhuja Nath, and today we are going to discuss about a topic that is things which no one will tell you about MCI. So I got recently a question from a student who asked me what are the subjects should be studied for MCI. So I'll begin my video with that itself. I am no one to tell you that these are the subjects you should choose. But as I have cleared MCI and over these years I have actually reviewed the papers which are there and people have solved. So I got an idea about how can you score well in MCI and what are the subjects you should focus on. If to tell what are the subjects you should study, if you have time, you should actually study 19 subjects. More the better. But if you ask me that what are the subjects which will help you fetch good marks in MCI or else clear in the first attempt, then here's the trick. Always choose short subjects and subjects where the questions cannot be actually twisted. So if I categorize the subject, in this category there will be subjects like derma, psychiatry, anesthesia, and these short subjects. Maybe these are 5 marks or 10 marks of subject, but if you actually get whole of 5 marks, just imagine there is no single mistake in what you actually answer. That's such a benefit. Then one more scoring subject is ophthalmology. Then comes ENT. These two are actually golden subjects. If you read them well and revise them well, they can fetch you really good marks. Then amongst major subject, there comes PSM and gynae. Again, super subjects for scoring. But here on the contrary, if we have medicine and surgery, not that I cannot actually take it to my side and be confident that well it is very scoring, because medicine is a subject, the more you study, more vast it is, and you never know what are the questions that can actually be in the exam paper. Maybe you have studied a lot of medicine, but then in the question paper you see contents which is not actually wasn't in your syllabus. You will be saying that, oh, I never came across this sort of question. So let's not go into that phase. It is better to concentrate on subjects and make those subjects so strong that you actually are able to answer everything in it. So that's one trick how you can actually score good in MCI, clear in first attempt, and also you can revise, because the more you learn short subjects, it is easier for you to revise. There is one more thing which no one will tell you, is that the goal in MCI is 150. The margin is 150. So the competition is not about seats. You don't have to compete that there are so many people appearing in the examination. I often get to hear this thing, the clearing percentage or the passing percentage in MCI is very low. What is this passing percentage? It is the number of people who have appeared in the examination and the number of people who have cleared the examination. But that is not what matters, because if you work hard, getting 150 is in your hand. It is not depending on the percentage. MCI board doesn't regulate the percentage. They never have told you that we have 100 seats, so we will not make these many people pass. There is no seats in MCI. If you get 150, you clear. It's a licensing examination. That is the basic difference between MCI and NEET PG. In NEET PG, we fight for seats. We have a certain amount of seat, and that is what we fight for. But in MCI, we just fight for achieving the margin, that is 150. And it's not about MCI, it's about licensing exam anywhere in the world. That is what you fight for. So that's one concept. Just clear it in your mind. You work hard, you clear. There is no competition in MCI. One more thing we should remember while preparing for MCI, that is, quality is always better than quantity. There is no meaning of just going through 19 subject once and not being able to revise. In the examination day, you will not remember a single thing. But it is always better to choose 11 to 12 subjects and being able to revise it at least 3 times. This is one thing I have repeated earlier also, and I'm repeating today also, because that is the key. With this, I'll tag one more line which is very important, that is revision is the key. Revise, guys, revise. Like seriously, if you read one subject today, every fortnight try to get back to that. If you don't get back to that, if you go back to that subject 1 month later, you will need extra time. If you have read gynae, suppose, just divide obstetrics and gynae, just try to go back to it. If you go back 1 month later, the whole thing will be new to you, and maybe you have to give the equal amount of time which you gave when you just reacted to the subject for the first time. Like when we see a subject, we react to it. That is our first time reaction to the subject. We need maybe 1 hour to read a chapter, but second time reaction to that subject is we need half an hour to read that chapter. That's what I am trying to make you understand. Then one more thing is, before 1 month of the examination, which is this exam is around the corner, it is end of June, right? So before 1 month of the examination, don't try to learn new things. That is one of the worst mistake you can do, is trying to learn new things just when your exam is around the corner. This is the time when you just revise whatever you have learned, just lock it. That's it. No new information is needed. Yes, you can gain a little more new information by solving questions. That's a different sort of studying, but don't open theoretical books and start reading, because that will not help you in any way. So these are all the points which I wanted to tell you about MCI, because most of the people will not come across these. So thank you, and with this I conclude my video. Subscribe and click the bell icon for the latest updates and notifications from Roots Education.